Can liposuction, Vaser, skin tight, all liposuction accessories replace an excess skin excision technique such as a brachioplasty or thigh lift? I get this question all the time. People come and see me, they want to do a liposuction of thigh and liposuction of the arm, trying to avoid a surgical excision scar. Can it replace it? The short answer is never. Never, never, never. If you do have an excess amount of skin with poor elasticity, no amount of liposuction, no device, no technique will replace the excisional technique of a surgery. Excisional technique is like doing a renovation and you do from floor to up. It means that you're doing a kitchen renovation and you change everything in your kitchen. Now, liposuction is like you're doing a renovation and you just change the cabinets. It doesn't matter if you use J-plasma, and everybody will respond differently to this equipment. So remember, don't be fooled. So sometimes some plastic surgeons, they give this hope that the small amount of liposuction with Vaser and J-plasma or skin tight or skin body tight can replace the excisional technique. It doesn't. Nothing. The longer scar that you have, the stronger the outcome you have, but unfortunately you end up with a scar. So depending what type of outcome you're looking for, make sure you educate yourself before you make a final decision.